So it's my pleasure to introduce today's speaker for our seminar series, doctoral candidate Lorna Bittencourt. Lorna is particularly interested in conducting research and community engagement that addresses health disparities. And no surprise based on today's presentation, but she has a particular focus and passion for tobacco prevention and control, broadly as well, cancer prevention and behavioral change, with an eye toward health equity. Before coming to the University of Minnesota for her PhD program, she completed her bachelor's in psychology and her master's in medicine and health at the Federal University of Bahia in Brazil. And so it's a pleasure to have her now here in the Division of Environmental Health Sciences, where she is pursuing her PhD. She landed a spot with one of the T32 training programs that we have at the U, and the particular one is led by Dr. Irina Stepanoff and Michelle Allen. It is a training program focused on cancer health disparities. And so, as you could tell, her research and interest is greatly aligned with that program, and she's furthering her skills in these areas through that program. Prior to her work with us and focus on the work she'll be presenting on today, she actually has worked on several other grants as a student investigator. She contributed to a grant that looked at self-collection and HPV testing, as well as breast cancer screening, and a tobacco control network that was for women in Brazil. She has been quite productive since she's been here with us, and also came with a really strong track record. She, based on today's date, she has 15 peer-reviewed publications, which is quite outstanding for a PhD student, and 5 of those are first authored. And she secured some funding for her dissertation study that she'll be presenting on today through the Masonic Cancer Center's internal grant program. So with that, it's just a pleasure to have Lorna join us today and to share about the work that she's been conducting for the past year or so that's making up her dissertation. So Lorna, it's all yours.
Thank you, Dana. So good afternoon, everyone. And thank you for the opportunity to present and to share my work with you. My work focuses on understanding the potential impact of cigarette design features, specifically the ventilation and menthol on smoking behaviors. So this presentation will outline the rationale behind my research, the methods I'm using to investigate my questions, and the potential implications for tobacco control policies. Okay, so I want to start by pointing out just how big of an issue commercial tobacco is in the US. It is still the leading cause of preventable disease and death. And now, while there's been a lot of progress in getting people to quit smoking overall, not everyone has benefited equally. Some groups have been facing more or different challenges, and these disparities have been around for decades. So that's why it is important to dig into these inequities and figure out what's driving them. So recognizing national goals and regulatory strategies have been established to further reduce smoking rates and promote public health equity. So Health People is a program from the U.S. Department of Health and Human Services, and it identifies public health priorities to improve the health of people in the U.S. So one of its goals is to reduce adult cigarette smoking rates in the U.S. to just 5% by 2030. So meaning we have a lot of work to do in the next 5 years if we want to achieve this. One effective way to see changes on smoking prevalence is implement policies. And the FDA plays a critical role in this effort because it regulates nearly every aspect of cigarette under the Family Smoking Prevention and Tobacco Control Act since 2009. So in 2009, the FDA banned all flavored cigarette except for menthol. And the goal was to reduce the use of cigarette among teens. The idea was that removing the appealing flavors would make cigarettes less attractive to young people, and it worked to some extent. We saw a drop in adolescent tobacco use. However, the fact that menthol cigarettes were still allowed restricted the possible overall impact. And why menthol was still allowed? So menthol was not banned in 2009 because of the intense lobbying from the tobacco industry. They paid spokespeople within the Black communities to argue that banning menthol would trigger over-policing of Black communities. They are using the same thing nowadays to talk about the menthol ban. Also, they said that a ban would lead to black market. And again, it's the same thing they are arguing nowadays. And also a ban would cost billions of dollars in tax and jobs as well. So this graph highlights the fact that cigarette smoking rates in the US are holding steady near historic lows. However, 12% of it, in fact, it is 11.1, like the results. I saw the newer results. So it is 11% of them. So we need to, if you want to follow the healthy people goal, we need to work a lot to decrease this in half. So while this decline is promising and it is important, it is also important to think about who makes up that 12%. So this is where we need to focus our attention, especially when considering factors like disparities and policy changes. So when we analyze the data, the smoking rate, the decline on smoking rates, we separate menthol from non-menthol smokers, we can see that menthol smokers has increased over time. And finally, the large decline in cigarette consumption in the US, it is linked to non-menthol smokers. So let's just talk about menthol cigarettes a little bit. So menthol has a unique appeal that sets it apart from the non-menthol cigarette because it provides a cooling sensation that makes smoking feel smoother and less harsh. This cooling effect can modify the perception of smoke, making it easier for smokers maintain their smoke habits. It also plays a role in smoke initiation, encouraging people to try smoking. Additionally, can impact quitting intent. So since we are talking about addiction, I think it is important to highlight the possible role of menthol in the brain. So we have some studies based on animal models that found that menthol has a unique effect on the brain, enhancing nicotine's impact, and making menthol cigarette more addictive because menthol would increases nicotine absorption, alters nicotine metabolism, resulting in a higher nicotine levels in the brain, and also enhances dopamine release. So apparently, there is like a brain component to the menthol, not just a behavior component or a social component. So Here, I just wanted to add to the discussion that Oliveira and colleagues published a paper based on tobacco companies' documents, and they found that subliminal menthol are added to non-menthol cigarettes too. So this amount of menthol, it is used to enhance tobacco taste, smoke, and like the aftertaste. I just wanted to add this slide here because when I'm talking to people, specifically menthol smokers, they are always talking about why just us? How about the non-menthol smokers? So if the U.S. decide to ban menthol, it will be in theory harder for the non-menthol smokers as well. They will feel something different. So menthol cigarettes also adds to health disparities in the US. So looking at the graphic, we can see who is most likely to use menthol cigarettes. This is largely due to the fact that tobacco industry aggressively markets menthol cigarettes to certain population. Here we can see that 85% of African-American smokers use menthol cigarettes, even though menthol cigarettes only account for 25% of sales. So how do the tobacco company industry does that? They have like a marketing program that includes advertisement in black like magazine, radio, and not just black, but Hispanics, youth. Also, they sponsor cultural events. They endorse, influential figures. Nowadays, they are working on environmental stuff just to pass the image that they care about the environment. And it is a way to talk to young people as well. So here I just added a mental ban timeline so we can think about this. In 2009, all flavored cigarette but menthol was banned here in the US, and it took the FDA like a couple of years to move forward and suggesting that menthol in cigarette is likely associated with increased smoke initiation and greater addiction, and also suggested that a menthol ban would benefit from public health. So I just want to add that policy, it is hard because if you add a word that can be interpreted in a different way, so the tobacco companies will use that to make it their way. So it's not just because it takes a lot of time for the FDA to respond, but they need to have more studies published so they can make their case that they have to ban or change policy related to tobacco. And then from 2018, the FDA has been working on the proposal on a menthol ban. However, they announced a lot of delays, and right now we are just waiting for a next step. So I would like to add that in 2020, a Black organization pressured the FDA to move forward with a menthol ban because of all of the things that they face related to the menthol cigarette. So right now we don't know what to expect. However, it is an opportunity to examine the mental ban impact and how to maximize their results. So these, regarding the results related to menthol ban, we have some countries that passed a menthol ban, and also here in the U.S. we have some states and towns and cities. So this recent systematic review and meta-analysis examined the effect of menthol cigarettes ban. So they found that after a menthol ban, 50% of non-menthol of menthol smokers switched to a non-menthol cigarette, 25% didn't switch, and 25% quit smoking. So those 20, I need to highlight that those 25% that keep smoking menthol cigarette it is more related to areas that did not pass a federal ban. And like, for example, here in St. Paul, people can drive and buy menthol cigarettes in like another towns. And this is one of the critics that the authors added. They said that they saw a limited impact of the ban when the ban was limited to a city or town. While a menthol ban can drive some smokers to quit, many still switch to non-menthol cigarettes. And this shows that tackling just the menthol issue might not be enough when we think about maximize the public health outcomes related to the menthol ban. So we could also look at other ways to make non-menthol cigarette less attractive, like filter ventilation, for example. I just want to add that these studies show that after 1 to 2 years after a menthol ban was implemented, they saw an increase of quitting on the menthol group, meaning that for the first time, the menthol ban quitting rates was way higher than the non-menthol. So, for example, in Canada, it was 23% of menthol smokers quit versus 15% of non-menthol smokers. So it is a big change. So regarding filter ventilation, it is the presence of small holes in the cigarette filter developed by the industry to reduce nicotine tar in machine-measured smoke. So filter ventilation reduces harshness of smoke as a byproduct. It also allows for elasticity, since the smoke can use their lips and fingers to close the holes, and smokers may adjust their puffing behavior, like taking deeper or more frequent puffs to maintain nicotine intake. So the tobacco companies also market those cigarettes using descriptors. They used to use descriptors like light and colors as well. For example, the tobacco companies have long used ads with terms like light and smooth to promote cigarette with a higher filter ventilation. And nowadays, usually the blue cigarette, the blue color is related to a higher filter ventilation. And since 2010, the terms like light, low tar, mild was banned. The FDA banned those terms. However, smooth, for example, was not banned. So the tobacco companies nowadays use descriptors as smooth and also the colors. So why smooth was not banned in 2010? So the descriptor of the smoke experience referred to the sensation in the throat and mouth. So it was not related to health risk or reduced harm. So the terms light, low tar was banned because of the association with, because filter intellect, like the term promote cigarette, and it was associated with a misconception that those cigarettes were less harmful than the others. So one thing that I would like to point it out here is this ad here. So we can contrast this ad to the red Marlboro, for example. It is like the opposite. So you can see this guy here is kind of fancy. So he's probably has a motorcycle, so you can tell, he's strong and everything. But because it is like a light one, he's kind of fancy. He has like fancy clothes. I don't know. I like to understand more about the cigarette, like tobacco company ads. So I would like to talk about filter ventilation now and some studies and its role on health outcome. So Carol and colleagues found that filter ventilation was not associated with biomarkers, because now we are trying to publish data related to filter ventilations. So maybe we can push like a ban in the future or a reduction. So Carol and colleagues found in this study that filter ventilation was not associated with biomarkers and or potential harm. However, smokers of higher ventilated cigarette perceived their brand as less harmful than other brands compared with smokers of lower ventilated cigarettes. So one interesting thing about this study, another interesting thing, is they also examined filter ventilation level of cigarettes, and they found that filter ventilation ranged from 0.2 to 61%. So all cigarettes had some kind of filter ventilation level. So this study explores how smokers perceive the risks of filter ventilation. So Caruso and colleagues found that the majority of smokers are unaware of how ventilation holes in cigarette filter affect their health, while some smokers understood the role of the holes and that they could dilute smoke and make it feel smoother. They didn't fully grasp the potential health risks, including lung cancer. So this suggests that smokers might be underestimating the harmful impact of filter ventilation. And it also highlights the importance of educating consumers. But again, one interesting thing about this study is that even though it was published in 2020, its results, it is very similar to one study published in 1996. So before the link the link on filter ventilation and lung cancer, for example. But the result was similar. So it is like a 20-year difference. So even though public health has been achieving things like banning flavors, and so people, 20 years later, people do not understand the filter ventilation role, and this and this can be like misleading as well. And now this is another study by Carol and colleagues. just highlight that the fact that youth and young adults who use higher filter ventilation cigarettes perceive the brand as less harmful compared to other brands. And this DS study just suggested that the ventilation design of cigarette filter mediates the relationship between smoking behavior and the subjective experience of smoking. So smokers may perceive lower harshness and smoother sensation due to the air dilution that happens caused by the filter ventilation, which could alter their smoking pattern, including puffy size and frequency. These findings discuss the role of filter ventilation in shaping smokers' behaviors and perceptions of harm. So I just added some filter ventilation marks to the decline in smoking rates, just so we can see what is happening. So filter ventilation was implemented in the US on the 70s. And at this time, we saw like a spike on smoking consumption, cigarette consumption. And then in 2010, the FDA banned some terms related to light, mild, and low tar, just because they found out that those, as I told you before, those terms was related to the misconception that those cigarettes will be less harmful. And then in 2014, and adding to this, in 2014, the General Surgeon report published said that they saw an association between filter ventilation and one type of cancer. It's lung adenocarcinoma. Adenocarcinoma, I just want to add that this is a change on trends, because adenocarcinoma is a type of lung cancer that has been associated with filter ventilation, and it happens on the peripheral area of the lung. But then when we see the overall lung cancer incidence in the US, you can see a decline of overall lung cancer in the past 2 decades. So what is good? But when we decide to separate the lung cancer by type, we see an increase of adenocarcinoma, and an important increase. And the rise is significant because while filter ventilation was originally marketed as a safer alternative, it may have contributed to the higher prevalence of adenocarcinoma as well. So the filter design thought to reduce the harshness of smoking and likely led to deeper inhalation patterns, increasing toxicant exposure despite the reduced perceptions of harm. So it is interesting how the filter ventilation was how they were like the goal of its introduction in the US, how there was like sold here as a less harmful thing, how people perceived the filter ventilation, and in reality, what kind of health outcomes we can see nowadays. So just to summarize everything that I just said, on 2019, the WHO report highlighted a rise in adenocarcinoma after the introduction of filter ventilation. So the experts categorized the following as substantiated by strong evidence. And machine yields do not reflect human exposures. So filter ventilation does not reduce disease risk. Removal of PEC descriptors, it's not sufficient to eliminate misconceptions of the risks of using ventilated product. Also, filter ventilation misinforms consumers about the health. So during my study, I will talk about my study a little bit. We asked people about filter ventilation, and they are really proud to say that their cigarette has filters, because the majority of them, as I just showed you guys, doesn't know about filter ventilation. They just know about filter, but some of them know about the filter ventilation, and they are really proud about it. Filter ventilation also changes combustion and dilute cigarette smoke, which change physical and chemical profiles and taste of smoke. So after all this review, we were curious about the menthol ventilation and filter, the menthol and non-menthol cigarette and filter ventilation. So how people, what kind of cigarette people who smoke, like are smoking here in the US. So we just found this. And one question that I had was, so after a menthol ban, those two blue groups here will have to quit or switch to a non-menthol cigarette, or maybe a less harmful product. But thinking about the ones that will switch to a non-menthol cigarette, based on this study, I would say that they will probably choose a higher ventilated cigarette. And however, another question was that what if we ban filter ventilation together, or reduce filter ventilation together with the menthol ban? What will happen with those three groups? So for my study, I am focused on the impact of removing or controlling filter ventilation in conjunction with a menthol ban. My central premises is that a dual policy of a menthol ban and filter ventilation, removal reduction versus a menthol ban alone, will have greater public health impact. Based on this figure here, I can discuss some factors like why people do not choose non-menthol low filter and with a low filter ventilation. So it is probably related to the lack of appeal and harshness. I don't know, I'll see. So my goal in this study is to assess the role of filter ventilation and its impact on menthol ban. So I will be able to find a lot of things about the non-menthol. However, filter reduction and or ban will help non-menthol people as well. So that's one of the questions that I've been asking when I'm presenting things, is that why just help menthol cigarette, specifically when it is a non-academic group. So trying to answer my question, I'm running a feasibility study, and right now our goal is to have 40 completers by the end of the study, 20 completers by arms. We have 2 arms. The first one is a high filter ventilation non-menthol cigarette, and the other one is a low filter ventilation non-menthol cigarette. So we are recruiting menthol smokers, and then they will be randomized for one of those 2 groups. Additionally, our sampling approach aims to ensure diversity, specifically because of the menthol smokers being related to minorities. And then we are recruiting half of our population will be white, and the other half will be non-white. So for this study, I have 3 aims. The first one is to assess the feasibility of the study, methods to conduct a completely remote study involving the evaluation of tobacco products in the real-world marketplace. So this study, there is no in-person visit. Everything happens online. The only exception is that the participant needs to go. The participant needs to go and buy the study cigarette. So we provide a clean card, and after randomization, the participant goes to a tobacco shop, gas station, and they can buy the study cigarette. My second aim is to compare the impact of people who smoke menthol cigarette being randomized to high versus low ventilated non-menthol cigarette. So we will be analyzed cigarettes per day, biomarkers, nicotine dependence, and other scales as well. And my third aim is to examine how participants' perception and experience with the assigned cigarettes influence their behavior and identity. So after the study, we conduct in-depth interviews with the participants. And we ask them, what do they think about the ban? How was the experience? What do they think would be a good idea to be implemented in case a menthol ban passes here in the US? And this is really important because we have a lot of studies, not a lot, but some studies talking about like the possibility of a ban. So what you think would be doing after a menthol ban? But in this case, they experience a menthol ban, and even though they cannot buy the products that they want to, but they have like experience. So we want to know what they think that public health agencies can do in order to help them on the quitting process, for example. So my study, it is a 10-week study. We are recruiting people from right now 2 different states. At first, we focus on Minnesota, and then we are slowly trying to recruit people from other states. And that's the beauty about like 100% like telehealth visits, just because we can recruit people from all around the US, and we can understand if they have like differences or not. So we have the baseline as well. So we mail participant medical devices so they can take care of their vitals. Of course, we are together during the telehealth visit, so we can we help them. Also, we have 2 prick tests, so we can analyze biomarkers, and we do everything like together during the visits. And like after the intervention period, of the 4-week period, we have a 4-week break and a follow-up question, a follow-up interview. So I just want to add that we've been trying to target like places when we run our online ads. Like, for example, here in Minnesota, we target like rural areas. Now we are focused on Louisiana, like the New Orleans area, and also the I think it is Houston. So we can find a more diverse population. I would like to add that this is so those are the two study cigarettes. So they have similar characteristics like the weight, additives. The only difference will be the filter ventilation. So since we want to understand the filter ventilation impact, so we chose those two. Conventional cigarette, meaning that people will go and buy the cigarette at their local gas station, for example. So where we are right now. So right now we consented 41 people. We randomized 23 people. We have 90 completers of the 4-week study, and 16 completed the interview as well, qualitative interview. Unfortunately, I just had to change these numbers because our participant had COVID at week 4. So, and then so far we have 12 white people participants and 7 non-white participants. So finally, I would like to share my learning process here at the U. So when I first started here, I don't know, 2.5 years ago, I talked to Dana that I would like to run a study. I would like to, I have some experience with research, but so far my experience was more focused on like some aspects. So I would like to have an overall view and also like experience. So I've been learning about regulatory and administrative things. So I've been developing skills on those things, like how can I send a IRB modification and CPRC as well, and everything related to bureaucracy. Also, I had the opportunity to to analyze how can we add tools to the research so we can be more efficient. So one thing is red cap. So we've been like changing things. So during the visit, I can be more efficient. And then when I'm going to analyze things as well. So we have red cap witch in our group, so I don't need to deal with this part. But I've been like thinking through ways to be more efficient. So additionally, I've been learning how to manage, participants and all of difficulties that they can face. And I've been able to train some research coordinators as well. This is interesting. And also, of course, the development and implementation of the study and thinking through all the, questionnaires and things that we should add or not. Like thinking about what we want to know, to understand. And also the analytical skills. I've been taking some courses specifically related to the qualitative portion. And finally, I would like to thank my committee for their guidance and support, but specifically, I would like to thank my research team because they are fantastic and they are very patient with me in my learning process. And that's it. Do you guys have questions?
Thanks, Lorna. What a wonderful deep dive into your work. And I enjoyed hearing about some of the areas that you feel that you've been developing as part of this trial and all the work you've done. We actually already have a question. Would it help for you to read it, or would you like me to read it, Lorna?
Can you please go ahead? Yeah.
So this is from Ellie, who's a PhD student with Arena. But she said, apologies if this was already stated and I missed it, but our mixed race, so for example, someone who self-identified as both white and black, counted as part of your white frequency for your study enrollment or the non-white frequency?
So just because we want to see the impact of things and how American perceives people, like mixed people. So if a person is mixed, like white and Asian or and black, we classify them as non-white. Or mixed people are non-white.
Other questions that folks have, feel free to unmute yourself or pop in the chat. And while folks are doing that, Lorna, could you share some of the maybe biggest challenges that you've had with running this trial?
So I think the biggest one, it is related to recruitment. Because it is not hard to change for no. I just like the last hour I was just talking about this. It is hard for menthol smokers to switch to a non-menthol cigarette. So I think they are interested. They come, we talk to them, but then they decide that this is not a good study for them because it will be hard to switch to a non-menthol cigarette. I think that's the big. We had some other issues, but then we have like experienced research coordinator in our team, so we were able to overcome those. Like for example, so one of the devices, it is a CO device that we mail people, and sometimes they didn't work. So Amanda, she's one of the research coordinator, and she had a lot of ideas on how to overcome this. And like for my participants, for example, was just a matter of volume their cell phone app. So it was just this. And we were able to overcome. And also we had like one problem related to the clean cards. Just because a clean card is related to research and people cannot use it in some stores, for example, tobacco shops, and alcohol liquor shops as well. So sometimes it was hard for people to find cigarettes on gas station, for example, and we had to come up with new ideas. So we called places and helped them find the study cigarette, or like I believe 2 participants had to use the ATM in order to pay for the cigarette.
Yeah, can get complicated, but sounds like a lot of trial and error. I think that's one of the beauties of your study is how ecologically valid it is, but definitely you've encountered some unique challenges that you guys are overcoming. What other questions or comments do folks have? Rena.
I am figuring out my new camera, so sorry, I'm a little goofy. But I just wanted to make a comment that Lorna, you did a really fantastic job on kind of giving an overview of this topic and why you're doing this research and why it is important to look at both a combination of menthol and filter ventilation. So just wanted to say congratulations. It was really enjoyable to listen to your presentation. I don't have questions at this time.
Yeah, I ditto that. Nice deep dive. It's a bit to wrestle to potential policies, and you did a good job. Willow, not to put you on the spot because you said something, I know you've really been uh, part of some of the efforts around the menthol ban. And so I'm curious what you think of the feasibility of bundling some of these policies, and maybe if it's not for the United States, certainly elsewhere, or just curious given that we have you here.
Oh, that's thanks. um, the idea of bundling those policies, I think, is really interesting. I can give you an update. We have a motion for dismissal next week. So we at the Public Health Law Center filed a friend of the court brief in support of the African American Tobacco Leadership Council's action to I was going to say encourage, but force the FDA to move forward with the menthol ban. And so next week, and the FDA has moved to dismiss it. And in support of that were the big tobacco companies. So, but I will say, initially, I saw the timeline that you put out. Thank you. And it was, I think, 14 years ago that the Public Health Law Center had filed a citizens petition to encourage the FDA to promulgate a rule banning menthol. And so it's been about 14 years since that time. And I will say that going back and revisiting what we requested 14 years ago is modified. What we wanted 14 years ago in a perfect world looks different than today. And so just thank you for the research. And certainly in a perfect world, even what we were asking for 14 years ago looks different than when originally requested. And it's thanks to research like yours and others that we're learning more about it. So I don't know about the specific aspects about it, other than to say certainly as we learn more and as the research progresses, an ideal menthol rule could look differently than even what we thought was perfect 14 years ago. So thanks for that research, and we will stay tuned.
Willow. Okay. Always awesome to have the community of experts here to weigh in, give different perspectives. Any final questions before we let you folks go for the day? Ellie, go ahead.
Yeah, if no one else has one, I'll take the last little bit of time. But I was curious if you've encountered, when talking to some of your participants or people you're polling, if they've reported like interest in, if menthol were to be banned entirely, picking up like menthol crystals at the pharmacy and like rolling it in to roll their own, and whether that's something people have mentioned. Because my little brother he's a pharmacist, and he was telling me, oh, I wonder if they would just mix our crystals in with that.
So we have a specific question about this. Unfortunately, we only have like 10 interviewed coded, but so far, I would say that during the interview, people are kind of mad and aggressive towards the menthol ban. So when we ask about other products, they'll say no. Like, I don't want to talk about this. I want to, like, why the US is like trying to ban. So I think one person said that they would like try to buy menthol cigarettes illegally. And the other people were like, no, I would try cigarette or other products, or maybe quit, because it is so gross. Like the non-menthol cigarettes, they have like the experience. But so far, I didn't hear anything about the crystals.
Interesting. Thank you.
Okay. Well,
Dana, I have a question. Sorry.
yeah. Go ahead, Dorothy.
And this is a question for you too, or anybody to answer. So, as you had said, Lorna, people are not necessarily supportive of the menthol ban, people who smoke. In fact, when you take a look at the data, they seem to be less supportive of banning menthol in cigarettes than reducing the levels of nicotine content in cigarettes to minimally addictive levels, which to me, I would think that the latter approach would not be as, as appealing to people who smoke compared to just banning menthol in cigarettes. So why do you think that is? I mean, why do you think that they tend to be less supportive of a menthol ban than making cigarettes less addictive?
So this is one of my questions for my paper. And when, like so far, when we compare to the filter ventilation reduction, it's the same thing. And my question is, should we try to focus on filter ventilation reduction because it will be easier? Because people are a lot more like, I don't care as long as I have a menthol cigarette. I don't care about the filters. So, but I don't know how to answer. I talking with menthol smokers, I can tell that it is more than a behavior aspect. I can tell that it's like like something like brand related. They are so we had two people that decide not to go after randomization. They decide to withdraw the study. And that was because of the lack of menthol flavor. So I think menthol plays like a huge role on people's like brain and the way they like the pleasure associated with smoking. So I don't know what you think, Dana.
Yeah, I almost feel there's this kind of culture around menthol cigarettes that stems from just such aggressive marketing from the industry. And really folks like associate themselves as menthol smokers. And we kind of know that they don't really know much about filter ventilation. So maybe that's why they're not as mad. And then, nicotine's in all cigarettes. So they haven't been, targeted in a way like that. So I do wonder if it's social norms, kind of this culture around menthol. But it's a really good question, Dorothy.
Yeah, I was really, well, obviously, filter ventilation ban or reducing levels of nicotine in cigarettes is more, targeting all smokers. And
Right.
I think, Lorna, you did make a point that, with menthol, people who smoke menthol, they say, why are you targeting us, essentially. And so you wonder whether the FDA should have flipped the approach a little bit, making reducing nicotine content in cigarettes more of a priority, and then maybe following it with menthol ban rather than the other way around. So anyway, just a thought.
Yeah. Great. Well, thanks for that. Thanks for the questions. Lorna, great job with your presentation, and we will see you folks next month. Thank you.
Fine.